The moment families hear the word tracheostomy, they think my loved ones will never recover from the stroke again. So, that is the biggest myth in stroke rehabilitation. As a physiotherapist working in neurorehabilitation setups, we see patients' family members become frightened the moment they see tracheostomy tube in the patient's neck. The first question they'll be asking is, Doctor, is this permanent? Answer is not necessarily. First, let's understand quickly what tracheostomy really is. Tracheostomy is a small opening created in front of the neck into the windpipe where a tube is placed to help patient breathe. It is not a feeding tube. It does not mean that treatment has failed and the patient is never going to recover. It is simply another way of providing safe airway to the patient when the patient cannot breathe or protect their airway adequately. So, why stroke patients need tracheostomy? Because the severe stroke can affect the brain's ability to control breathing, coughing, swallowing, etc. Some patients need prolonged ventilator support, and some cannot effectively cough out the secretions, and some have repeated aspirations, which automatically puts their lungs at risk. So, in these situations, the tracheostomy helps to keep the airway open and makes the breathing safer. It can also be more comfortable than having a breathing tube through the mouth for a longer period. And here's the part many people don't know. Tracheostomy helps in rehabilitation. As a physiotherapist, we can start with the breathing exercises, chest physiotherapy to clear out the secretions, and making the patient sit, stand, and making the patient walk. So, basically, the early mobilization part becomes more safer if the tracheostomy is present. And when the patient improves, many tracheostomies are gradually removed through the process called decannulation after a thorough medical assessment. So, please do not fear about tracheostomy. Tracheostomy is not about one tube, it is about giving the brain and body enough time to heal safely. Instead of fearing, let's understand why that tracheostomy is there. Because that small tube is what allows that patient to breathe safely and start with the rehabilitation early and take few small steps toward recovery.